everyone, my name's Catherine. Today I'm going to talk to you about assessing the mental status of a patient. I'm going to go over how to use the mini mental state examination on a patient. But first I'm going to tell you guys a little bit about what we use the exam for and why we examine mental status. First off, mental status is a person's emotional and cognitive functioning, and it's really important to assess that with a patient so you can get a full scope of what's actually going on with them. It's kind of difficult to assess. It's not like you can get a scan of it like you can a lung or a heart. We have to assess this by using different techniques to look at patients' behaviors, their orientation, their mood, affect, how they speak, their language, their memory, thought content, and thought process. So those are things we look at when we assess a patient's mental status. Some disorders we look for, there's more organic disorders such as delirium and dementia. These have a known cause. This can also include alcohol use and drug use. And other disorders we look at are the typical ones like schizophrenia, bipolar, anxiety, that kind of disorders we look at. Okay. This assessment documents dysfunction and how that dysfunction affects the patient's daily life. There's 4 main components of this assessment. It includes appearance, behavior, cognition, and thought process. So today we're going to perform a mini mental status examination on a patient. So we'll just have the patient come in. Okay. I'm going to wash my hands before I do anything. Introduce myself. Hi, I'm Catherine.
Hello, Catherine. I'm Benny.
It's nice to meet you.
Nice to meet you.
Today we're going to do a mini mental status examination on you.
Okay.
That just involves me, asking you some questions. It's going to assess your orientation, your attention, calculation, recall, language, and motor skills. So
Okay.
It's just several questions I ask to kind of determine how your mental status is.
Okay.
Okay. And we use it all the time. It's pretty quick and simple. It's not anything super difficult. So, okay. Each section of this involves a series of commands. You're going to get 1 point for every correct answer. So, okay. So I guess we'll get started. Can you tell me your name and date of birth?
My name is Benny Story, and my date of birth is March 22nd, 1990.
Okay. This first question is going to be kind of an orientation to time. Some of the questions might appear redundant, but that's just kind of how the test is set up.
Okay.
Can you tell me what today's date is?
June 27th, 2020.
Okay. What's the month?
June.
Okay. What is the year?
The year's 2020.
Okay.
2020.
Good. What is the day of the week today?
Saturday.
Okay, good job. What season is it?
It's summer.
Summer. Yes, it is. It is very hot right now. Okay, next I'm going to talk to you about the place we're in and assess how you're oriented to where we're at right now. Does that sound okay?
Sounds good.
Okay. Can you tell me whose home this is that we're in?
This is our home.
Okay. What room are we in right now?
We are in our living room.
Yes. Okay. What city are we in?
We are in the city of Petal.
Okay. What county are we in?
Forest County.
Yes. I have problems remembering that myself because we're so close to Perry County. So.
This is true.
And what state?
Mississippi.
Mississippi. Okay. Good job. Okay. So this next test is going to, test your immediate recall. I'm going to name some items, and you're going to repeat them back to me.
Okay.
It just kind of, not really short-term memory, but kind of in that area. Like I said, it's immediate recall. So, okay. Ball, flag, tree.
Ball, flag, tree.
Okay, good job. Okay, I'm going to ask you that a little bit later, and I just need you to repeat them to me whenever I ask you.
Okay.
Okay. This one is kind of difficult because I'm not very good with math. So, it's just kind of to test your attention. I'm going to ask you to begin with the number 100 and count backwards by 7.
Okay.
And you're going to stop after you subtract it 5 times.
5 times. Okay.
Yes.
Okay. So 100, 93, 86, 79, 72, 65.
Okay. Wow. I could not have done that. I'm not very good with that myself. So. Okay. Do you have any questions so far?
I do not.
All right. If you do at any point during, this time, just let me know.
I will.
And we'll go on with the next portion. This is kind of also to assess your attention to things. I'm going to ask you to spell the word world backwards. So just kind of whenever you're ready.
DLROW.
Okay, good job. Okay. I'm just going to ask you to recall the words I asked you earlier.
Ball flag tree.
Okay, good. That assessed your delayed verbal recall, so it's
Okay.
kind of after a delay that I asked you. It's good that you remembered. Okay, I'm going to show you 2 items. Just kind of tell me what you think they are.
Okay.
So, what is this?
That is a coffee mug.
Okay, good job. And then, what is this?
That is a pen.
All right. Not very difficult at all right there. This is gonna just kind of, I'm gonna say a phrase and I'm gonna have you repeat it after me.
Okay.
Okay. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, good job. This one is called 3-stage command. So I'm going to just give you a 3-stage command and just have you, do what I say, basically.
Okay.
Okay. When you take this piece of paper in your hand, fold it in half and put it on the floor.
Okay.
Hey, good job. Okay. You did all that. Great. So this next one is going to assess your reading comprehension.
Okay.
I'm going to hold up a piece of paper with a command on it. You don't have to read it out loud. Just kind of do what it says.
Okay.
So, okay.
Okay.
Okay. And that said close your eyes, and he did that correctly. So that is a, correct response. Okay. This one of the last things I'm going to ask you to do is write a sentence for me. Just any sentence off the top of your head. It doesn't have to be planned. Just go ahead and
Thank you.
yeah.
You can read that.
Okay. He wrote, I am writing down a sentence. So that is a sentence. So you passed that. Really good. Okay. And this last thing is kind of involving, copying a design of 2 shapes. So I have here this design, and if you would kind of copy it to the best of your ability on this paper right here.
Okay.
For me. Okay. And he copied 2 5-sided shapes, which is what I showed him to begin with. So that concludes this. I'm just going to go ahead and add up your score, which, you scored perfect on all of it, so you got a 30.
Cool.
So when you take this exam, anything below 20 usually indicates cognitive impairment, which he has not shown any cognitive impairment whatsoever. So that's always good to note. As a side note, when we're doing this exam, we always look at the patient's dress, and he's well groomed, dressed appropriately for the weather. not responding to anything other than my voice. Things like that we can take into account. So just little things you can notice sometimes. Maybe the patient's hands might shake. That could be related to medication, and that's also something you need to take into account when you're assessing mental status. Is if they're on any medication that might, um, you know, over sedate them or make them less responsive to the questions. So I guess that's it.
Sure.
Thank you for watching.